Good morning. I'm Dave Johnson from the Employee Assistance Program at Parkview Health, and I'm here with my good friend, chaplain from Parkview Health, Dr. John Swanson. And so, John, you and I have been privileged throughout our careers to look into the eyes of folks that we serve, and sometimes those folks that we've encountered in our practices have been scared. They've been filled with fear. And I think we're, with this COVID-19 pandemic, that the virus of fear is as widespread as the actual COVID virus. And so I wondered about us kind of leaning into a little bit of a conversation about fear, and perhaps some of your thoughts and recommendations, maybe some ideas about fear. What do you say or do with your own fear, and perhaps the fear that others are experiencing during these times?
Oh, I'm laughing because you would have to start with my own fear. Just this week, I had an early morning shift, and as I was getting ready to go in, I said to Nancy, I'm just anxious about today. And it wasn't any specific anxiousness. It was just this generalized feeling of, And it turns out that I might have been right. It was one of those cases where an 8-hour shift condenses into 12 hours. So it was a long day with some really hard conversations. However, early in that shift, before anything had started, I wrote down on my notepad as I was running down the stairs, you know how to do this. And I realized that one of the things that happens with anxiety and fear is we get this tunnel vision thing, and we forget that we actually know how to do things. And so in that moment, part of my dealing with my own anxiety was just looking at myself and saying, you know how to do this. And I think that becomes a helpful thing when I'm talking to myself. When I'm talking to other people, I almost never start with, you know how to do this, because I think that we have to start with understanding that fear is a response to a perceived threat. Sometimes it's a real threat, sometimes it's not, but fear is a response. And so our best way to help people, I think, is to start with the fear. Start with acknowledging that, oh yeah, you are afraid. And at this moment, that's a real feeling for you. And so that way they're not having to prove that they are afraid. We're starting with acknowledging that, oh, you are afraid. Let me sit there with you for a second or two.
The idea of affirmation, of setting intention for the day. And so I really like how you set intention, and even so practical as just writing that intention down on a piece of paper, a note card. So I really like that pointer. And for me too, John, the notion of presence, because I was going to lead into the question, so what are you doing for others? I think the gift that we can give each other is presence right now, and not trying to jelly or talk people out of their fear, or to jelly their fear. And one of the things I know, I was reading one of your blogs, and it was, this is hard. That this is hard blog. And I thought, oh my, even having a go-to response, that this is hard. And today, as the pandemic continues to unroll, and we're at even a different place, and the velocity of change, to validate people in real time that this is hard. So I'm sure you're using those words quite a bit in your presencing with others as well.
Part of wrestling with fear is deciding fear of what, fear for what, fear that what. And so being able to say, this is hard, gives us that starting point to say, all right, what is the it that is hard?
Yeah.
That forces us to move away from the, oh, you just do this. Because if I'm sitting with you and I'm aware that you are now afraid, that your kids are going to go hungry because this is going to make you sick and you're not going to be able to provide. There is no just to that. There is no quick solution. There is starting with oh, yeah, that's a real fear. We may need to talk through that a little bit, but let's start there. That's a real fear, and this is hard.
It reminds me in my mindfulness-based practice of anchors. And John, you've been an anchor to so many folks in our health system and community with your words, with your blog, with your presence. And so talk a little bit about anchors. I teach people breathing, and I teach people anchoring with sensory, still like my coffee or tea, and to smell it, to come out of my thinking and overthinking and worried brain. And I see you using presence as the anchor, John. Are there other anchors that you recommend for people that are having great fear, or their metaphors, or their recommendations to help them come out of that neocortex, that thinking and overthinking and worried brain? There's not a quick answer.
The other day, I walked into the office of a coworker, a colleague, a friend, and I sat down in the chair in her office, and I looked at her and I said, I don't do this very often, you know me. And I only have 45 seconds, but I just need to say this. 3 deaths in 3 hours is really hard. And then I had to go work with the family of the third one. But I think that we are so concerned about being invincible that one of those anchors is being human, is learning how to say to somebody without fear of being judged for it, without fear of it revealing that we are weak or whatever, but to look at somebody and say, this is hard work that sometimes we do. And as I think about it in our healthcare environment, there are some people that get identified as heroes, but if you are the person who has to walk into a room and clean it after something awful has happened in that room, there's fear associated with that. And that takes courage. And that happens all the time in our facilities. There are people that wear all different colors of uniforms that have the fear that goes along with their, and so I think that's saying, no, that is a hard thing. There's no such thing as comparative fear. Some of us have had our lives fall apart. And that gives us a little bit of anchoring to know that you can take really hard things and you can survive them. And so I think that one of the gifts that we can offer to each other is, I went through really hard stuff and I survived. I was changed, and it's not easy, but I made it, and I want to help you make it too. Yeah. Which is different than saying, well, I made it, you ought to be able to.
Right.
But there's that fundamental difference of with, that's an important thing. You get that, you do that all the time.
I do, but one of the reasons I really like having conversations with you, John, is because, sometimes those of us in various roles of therapy or ministry, or being a dad or a grandpa, and especially after our parents pass, we come to that realization. It's like, oh, we're who do I call now? I can't call my mom, can't call my dad, and so we're left to be the anchor where the adult child calls us, or the client calls us out of fear, and we're the anchor. And so it's like, oh, I have arrived.